Hello everyone, welcome to Parent Education module on COVID-19. This module is going to cover COVID-19 and third wave. I am Dr. Rakshay Shetty. I head the Pediatric Intensive Care Services at Rainbow Children's Hospital, Marathahalli, Bengaluru. So, are children going to get affected more in third wave? Does scientific evidence suggest that? Now, this is an interesting question and seems to be widely discussed in the media. But what we have learned, as well as the scientific world says, is that it's unlikely, because the experience of the first wave and second wave, be it here at Rainbow Children's Hospital or across the world, suggests that in majority of the children it tends to be mild to asymptomatic infection. However, it is likely that the more number of children might get infected compared to adults in third wave. The reason being that the children are not vaccinated, so it certainly makes them more vulnerable to catch infection. Parents do ask, oh, we heard that children can never get affected with COVID. That's not true. The children, like adults, can get infected, but it is just that they don't become seriously unwell like adults. So it tends to be for most part a mild illness. Having said that, that's the experience of first and second wave, and we've known that the COVID-19 has thrown enough surprises. So it's better we be careful and prepare ourselves to a situation where children might get affected because of COVID-19. So how do we prepare? In this module, I would go on to two parts. One about how family can prepare and how as a Rainbow Children's Hospital we have prepared. So in an effort to fight this pandemic effectively, we have come up with this patient educational module series so that you get correct information about COVID in children. Unfortunately, there is too many information available. Some of them are correct, some of them are incorrect. Now, with our collective experience of having managed several children with COVID, we hope that this educational series will be beneficial to you by providing correct information. So what as a family we can do? I think it is very important that every family member who is eligible to take a vaccine, that is more than 18 years, should go ahead and take vaccine. What we have learned in these two waves, especially the second wave, is that those who got vaccinated, the complete 2-dose set, are protected from a serious disease. Some small fraction might suffer from breakthrough infection, but almost never they land up in hospital. So it is very safe and very effective. And that can protect your child too, because if you vaccinate, the amount of viral load in you will significantly come down. The other important part is also protecting your child from other illnesses. So ensure that you take all other vaccines in a timely fashion. Take a flu shot. The reason for that is majority of the manifestation of flu will be a bit similar to like COVID. So it might land up unnecessary too many hospital visits. So by taking these vaccine shots, you are going to decrease your hospital visits. Now we know that the Delta variant and plus an emerging Delta plus variant. What that means to vaccinated people? What it means to vaccinated people is, what we know is vaccine, even for these variants, protects us against severe disease. However, unfortunately, it might not protect you from getting an infection, a mild infection. The problem with that is you might still transmit a virus to your child. So despite being vaccinated, we would advise that you follow your COVID appropriate behavior. Masking when you're out, maintaining social distance are still of vital importance to fight third wave, and that should not be forgotten. Other very important aspect is focusing on mental well-being and physical well-being of a child. Unfortunately, what we have noticed is too much of COVID discussions about third wave, about how adults are getting affected, how children might get affected, is adversely impacting the mental health of children. We've had admissions to the hospital where children have come because of panic attacks, where parents have constantly checked temperature and thought it is fever. So it's very important to have a positive attitude and have a feeling that we are going to conquer this illness. That's very important, because for us to develop a good immune system, a positive mental health is very important. And negative mental health can impair our hormone production, can excessively produce steroids, can impair our immunity. So let's be positive and face this together. Physical well-being is an extremely important component. What we have noticed during this pandemic is extreme obesity. And what we have also understood is this obesity can have a negative impact if you were to catch COVID. Obesity can increase the chance of severe COVID. In a separate module, we are going to cover both mental well-being as well as physical well-being of a child during this COVID pandemic. Apart from this, how as a hospital have we prepared for, if at all, an eventual third wave to happen? Now, Rainbow Children's Hospital is the biggest children's healthcare provider in the country, and with a capacity of 280 beds, In a children's hospital across Bangalore, we are the largest healthcare provider for a child in Bangalore. Now with this, over a couple of waves, we have learnt a lot. We have managed quite a bit of children on outpatient basis, and in this second wave itself, we have admitted more than 300 patients, children, in our hospital to manage COVID. And this has taught us a lot. It has taught us as a group of clinicians about how do we optimize outcomes of these children. We understand that COVID is not just like any other illness. It needs a family-oriented care. And many times, for example, a pregnant lady wanting to deliver, it needs a sophisticated care where a mother and child can be taken care together. And this wave has actually taught us how to handle a child and a family with a COVID in a much more effective manner. Being a children's hospital with a specialist not only in ICU, but an infectious disease specialist, a rheumatology specialist, a newborn specialist, neurology specialist, all these specialists being available under one roof has helped us to manage COVID battle in a much more effective fashion. With more than 70 beds in newborn ICU and more than 40 beds in a pediatric ICU, with a total bed capacity of around 280 beds, we have made ourselves ready in case if this pandemic were to occur. So in the end, I want to summarize by saying that it's unlikely that COVID might specifically cause severe disease in third wave, but nonetheless, we've had enough surprises with COVID-19, so we should still be prepared for that eventuality. There are a lot of things as a family we can do, ensuring that all of us get vaccinated, ensure that the child completes its vaccination list, keep a positive mental attitude, focus on physical health, and then as a hospital, we are there ready to serve. Finally, one more point I would say that you should discuss with your pediatrician that in case if there is an eventuality where a child needs admission, find out a nearest children's hospital which can take care of your child effectively.